Hello and welcome to Health Live at Seniors Today. We are living in unlocked times. While there's a fair amount of fear of the coronavirus, there's an equal worry about the fear that exists. Cases of depression and mental health issues are on the rise, as are those of domestic violence. We are delighted to have here with us psychiatrist and psychotherapist Dr. Milan Balakrishnan. He will speak with us as well as address your queries. A little about Dr. Balakrishnan. He is a consultant psychiatrist at Bombay Hospital and Masina Hospital, an alumnus of St. G.S. Medical College and KEM Hospital. He is secretary of the Bombay Psychiatric Society. He is director at Mindcares and has researched a fair bit on dementia and geriatric problems. Now, all of this I was reading from his CV. He's a believer in unconditional love and chocolate ice cream, technology in mental health, stigma, mindful, AI, and machine language, and which he hopes will transform healthcare. Also, his Twitter handle is Milan the Shrink. Dr. Balakrishnan, welcome to Health Live.
Thank you so much. Thank you for that lovely introduction. And I didn't expect my Twitter handle to come up.
But I must ask, all of us refer to your tribe as shrinks, but here you're calling yourself that. How does that work for you?
Like I said, it gives people the comfort to reach out more easily without being restricted by a stigma, which is one of the biggest issues with mental health. Although that's changing, but still we're still a long way in overcoming that stigma. So when we talk about mental health of the elderly, we're talking about our parents, people very close to us, isn't it? And we're talking about 100 million population in India, which is 60 and above, and of course they go with their multiple problems, physical health issues and mental health issues, which often go hand in hand. So dementia is a common problem, depression is a common problem, anxiety issues are a common problem at this age, and along with it now, with this whole COVID situation, the lockdown and now the unlock, uh, people who had a certain who had retired, lost their routines, had gotten back a routine, have suddenly found themselves losing their routine all over again, and that definitely has had a lot of impact. So it's like a vicious cycle of loneliness, anxiety, depression, and worsening of other physical issues related with the mental health issues. It's all a vicious cycle that really puts the elderly as a part of a very vulnerable group, which are highly at risk and even seeking help for them. For example, a lot of elderly would like to seek help at this time, but then their discomfort with technology. So most of the elderly are picking up the phone and trying to connect. So they're doing their bit in order to seek help, but it does become more difficult for them to reach out. So I think we need to definitely address these problems, and we also need to see how everybody around the house, or those who are connected to the elderly, if the elderly are living alone, can ensure that they are checking in regularly and staying a part of the support system even more in this particular crisis time.
Now tell me, Doc, in terms of the number of people who come to you on pre-COVID and now post-COVID, has that number increased? Would you say? And are there certain types of people who are coming in larger numbers than earlier?
Right. So it's usually uh, the already vulnerable population. So someone who was already suffering from anxiety, mild depressive symptoms, not enough to kind of find the need to seek help are now finding themselves pushed over the edge. This whole COVID situation has made it, has added to the anxiety to such an extent that they're they are more likely to seek help now. So the numbers have definitely increased in terms of uh, people are more willing to seek help. Those who would have felt that they could deal with their problems relatively on their own with a good support system and people around them now find that that doesn't seem to be enough.
We have a question from Sham Somaya, who says, a 74-year young man. I'm losing my self-confidence trying to avoid things. My thoughts go into negative, only I'm scared what will happen tomorrow. I can't concentrate on my work. I'm losing weight because I'm avoiding to eat. I give excuses and speak lies. Please guide me what to do.
And speak lies.
And speak lies.
Okay. So, Sham, I think this all of these symptoms in terms of losing appetite, uh, losing weight, not wanting to eat, losing focus are definitely early signs of depression. So that needs to be taken into account and taken care of. Meanwhile, I would need to understand what are the things you're doing to take care of yourself. So simple things like uh, ensuring that you're trying to get back into a reasonable routine, trying to get back into exercise if you were exercising before this, and if you weren't, to start off at least with walking or moving around within the house for 25 to 30 minutes. But this sounds like something that may need clinical assessment and detailed treatment if necessary.
Uh, we have a question from somebody who doesn't want to be named. Uh, he asks you, sir, I'm retiring in a few months from now. The savings accumulated by me for my retired life suddenly looks insignificant. Though we have adequate medical insurance, but the way the hospitals are fleecing makes me wonder what could happen tomorrow, but not only to me, but to anyone. Also, the savings rates have gone down substantially. Plus, the economy is in such bad shape. I'm sure I'm not the only one, but most others also have similar issues. What's your advice for a large number of senior citizens who are
Hmm.
trapped in this environment?
So, financial worries post retirement are one of the and economic worries are one of the commonest things that are driving anxiety, right? Also, anxiety makes you kind of uh, interpret things in unusual ways, meaning that uh, you may, if you asked all the people around you, they would say you have a reasonable amount of money, but the anxiety makes you feel that uh, this is way too little, and this cannot kind of suffice for me. uh, so anxiety is that kind of thing that makes you interpret things differently. Also, in this current situation, taking care of your health is very important. uh, Continuing to maintain uh, all the kind of rules of sanitizing, cleaning, washing your hands regularly, social distancing, avoiding going out too much or mixing with people too much, all of that in order to ensure that your health is reasonably safe, and making sure that your other physical health issues are taken care of, so that you don't uh, hopefully need to visit a hospital. uh, Also, I think this whole thing about hospitals policing, we'll keep that out of this discussion.
The next question for you is from Sukanya Bharti. And she asks, what should be the ideal way forward for a lady who lost her husband and has been ignored by her children at the age of 57? I am living with my brother's family in Kerala.
Yeah, no, okay. Hmm. So, per se, one, creating a social support system is very important, whoever it may be. It may be old friends catching up with old connections, locally finding connections, or doing something that engages you, which could include, say, voluntary work, or helping out in any organization. So definitely, helping others and keeping yourself busy in terms of helping others definitely helps in keeping us low on anxiety. Also, it takes care of our mood in general, keeps us happier. And so, ensuring a social support, it may necessarily not be close family. It may be friends, or it may be even acquaintances in the neighborhood who support each other and listen to each other when required. So creating a social support is essential for people of this age group.
We have a question from Mr. Jagmohan Walker, who asks, how does a 60 plus safeguard from dementia, Alzheimer's, Parkinson's precautions? What should be done next, given the present stress and anxiety situation?
Okay. Um, Mr. Gupta, uh, dementia, Parkinson's, all of these are are illnesses that we are more at risk as we age. To a large extent, they are determined by our genetic vulnerability to it. So, if there's a strong family history of any of these, there is a high chance that we may suffer from it. So, but if you say what we need to do in order, so we may not always necessarily be able to stop these illnesses from occurring to us completely if they're likely to happen. But what we can do is, uh, when we have a better cognitive reserve, by that you mean that dementia is worse for those who who don't tend to use their brains throughout their life, while for those who have maintained an active lifestyle and continue to maintain an active lifestyle, uh, dementia is not so intense, progresses very slowly, and is much easier to manage. So the primary idea being keeping yourself alert, engaged, reading, up to date with the times, uh, but not watching too much of news, because in the current situation there's so much of a bombardment of information and confusing information that it is more likely to worsen our anxiety. So basically, engaging with people, talking to people, having interesting conversations, listening to newer information, which keeps our brain active, is a great way to deal with all of these neurocognitive disorders, as we call them.
It's interesting to hear this, Doc, about the kind of information that is there, the information overload that is there, and all sorts of information, a lot of negative information, and a lot of contradictory information. There is, old videos which are being released now, which perhaps were dated sometime early March or February. So the information that is there is incorrect. What do you think should the media be doing? Is there any advice from you for the media to, ensure that they do not add to the anxieties of people?
Absolutely. I think the media needs to be very careful in what they are uh, putting out to us. So the media does a great job in relaying important information to us, no doubt about it. And through media is where we get all our vital information. But uh, so also the media needs to be a little more sensitive towards uh, thinking of what is going out there. So sensitivity versus sensationalism should be something that media should be very alert about, because this is information that you're putting out to a huge mass of people. Like I said, the elderly especially are more vulnerable, because uh, they're more likely to be stuck in the house and viewing all this information, and this information could have uh, an extreme impact on their anxiety levels. So I think the rule of the thumb for the media would be that would they want to put out something that would leave their parents or family disturbed. I think that would be an easy enough filter for them to kind of decide whether this should go out there or not go out there.
We have a question from Sunil Maru. He says, I'm 60 years of age and I was on the ventilator 20 years back after my bypass, and it was unbearable. Now I'm highly stressed and anxious about being put on the ventilator. Is there a solution?
Right. So, very importantly, one, taking care of yourself in terms of ensuring that you uh, do not fall ill in this current situation. Also, uh, doesn't mean that every flu or even a COVID would not necessarily put you in a situation where you may have to be on a ventilator. Uh, Also, uh, there are options uh, in terms of where you can have an advance directive to your doctors, which says clearly that I will not and would not like to be put on a ventilator.
We have a question from Dr. Narendra Shah, who says, due to stress, I am 69, I'm suffering from post-stipulation. What is the solution?
One, again, like I said, very important is to restrict the amount of this information overload. Taking care of your uh, anxiety, I would recommend, if you're already, say, doing certain breathing exercises, simple exercises like pranayam, or just anulom vilom, for example. If you're already doing that, great, continue to do it. Make it ensure it is a regular practice. If you are not, it's a good time to start now. Again, like I said, important issues is having a good support system, having people to talk to, talking to your family members, even if they're not, say, in the house, ensuring that you call them at least once or twice a day. If they're away from you, even if you can connect to them on a video chat on a day-to-day basis, so that you have someone to talk to, listen to, and also this sharing of information among the family does help create a kind of support system to help you relax. If you find the anxiety still out of control, unmanageable, and associated with any uh, physical problems like lack of sleep, lack of appetite, uh, lack of energy, lack of interest, uh, severe mood disturbances, then it may not be a bad idea to seek help.
Doc, are there any, it may not be very easy for people to approach a psychiatrist apart from the social stigma that exists in, approaching a psychiatrist because it's considered as mental health, and there is always a hesitation to approach a psychiatrist. So are there helplines available that somebody could approach in case in case
Sure.
she or he is
What I
feeling?
can do is I can put out a list of helplines, especially a lot of helplines were already there and have also started during this outbreak, including one from Bombay Psychiatric Society. I could share the details of those helplines. Sure,
We
I'll
have
send it.
from Dr. Aradhya Singh. Sorry, I'm 71 years young, facing problems with acute sleep disturbance and loaded with negative thoughts like little high BP that is spoiling my health further. Uh, what should I address? Or what should I do to address these issues? You have, in a sense, answered this question, but specific about the little high BP that is that is impacting her health.
Hmm. So one, in terms of sleep, some of the simple things that you can do is what we would call uh, having good sleep hygiene, trying to ensure that you sleep at this almost the same time and get up at the same time, avoiding any uh, tea, coffee, or stimulants like cigarettes or tobacco in any form after 7 p.m. Uh, Trying to have some amount of exercise in the day so that energy levels are expended, and also having a kind of slowing down process which starts at say around 7 p.m., where you start uh, lowering lowering the lights in the house, closing the windows a little, ensuring that maybe even taking a warm water bath in the evening, and playing some comfortable music that you like, or reading a soothing book, and slowly kind of getting into a routine that allows you to then go to sleep.
We have a question from Andy who's saying, what do you think about alcohol as a stimulant?
Hmm. Right. So in terms of alcohol, the issues are that it tends to be like a short-term anxiolytic. It seems to reduce your anxiety initially, but as you consume it on a regular basis, it loses that potency. So which means that you're more likely to consume more and more in order to get the same amount of relaxation, and which also in the long term is then tending to have an effect on reducing the nutrients in our body, which in turn can impact the brain and increase the chances of dementia.
We have another attendee who asks the question, any suggestions for doctors, police, and other corona warriors to come out of stress as they finish their duty of the day?
Hmm. So right. So all corona warriors go through a lot of ups and downs through the day. Definitely, uh, also most of their focus is on also helping others, and at the same time trying to protect themselves. So that's kind of a virtual tug of war that they go through. So at the end of the day, it's important for these people, for all of us to kind of switch off, in the sense that try to shift to getting back to family, connecting with family, communicating with them, discussing the day just to ventilate all the emotions and feelings that they have experienced through the day. And so having someone to listen to what they have been going through is an important way to kind of unwind. And again, taking adequate rest once the day ends, because it's obviously going to be a very exhausting day.
We have a question from someone who says that we've had a very peculiar relationship in the family. We do not really talk very much. When I come back from office, I'm I come home, have my dinner, watch some television, and go to sleep. Suddenly, we are thrown in a situation where all of us are there together, and that itself is uh, causing a bit of anxiety. It caused a lot of anxiety in the early days, but it still is doing that. How do we uh, uh, adjust and adapt ourselves to this new normal?
Hmm. No, so this is something that everybody is going through. People who are busy at work most of the time are suddenly forced to kind of spend more time together. So it's a it's like a double-edged sword. Can it helps to get into conflicts with these people as well, and as well as it is an opportunity to kind of look at kind of finding a reconnection, kind of getting back to uh, communicating better with them, rediscovering that relationship, in the sense it may be a slow process, it may be a difficult process, but we'll have to we'll have to look to commit to that in order to be able to do it.
We have a question from Atul Shah, who says, I'm a diabetic. How much should I be careful and do what daily? I know this is not really uh, concerning you, but there are questions that are coming in from people about medical issues, and
Right.
obviously it is stressing them out in terms of being able to approach their doctors.
Hmm.
And so, is there some general overarching advice that you would like to give people who have uh, uh, what is called comorbidities?
Hmm. So ensuring that they are on their regular treatment. If they have for any reason discontinued treatments or become irregular with treatment, to go back to being regular with their treatments, uh, trying to get back to, so for example, somebody with hypertension or diabetes needs to get back to their physician, uh, maybe even via an online consultation, and try to just check with them as to how their doses are, what they should be continuing, and what they should be uh, taking on a regular basis. So that is something that we need to be aware of, ensuring that we are well controlled in terms of all these comorbidities.
One of the questions I would like to ask you is that do you think the government is doing enough to, while it's doing a fair bit about coronavirus and ensuring that there is enough healthcare facilities, but is enough being done on in the area of mental health? Because clearly there's a fair amount of stress that is coming up. We have so many questions coming in, and we are aware of, and as you also mentioned, that the number of cases that are coming to you has leapfrogged.
So, in terms of uh, whether the government is doing enough, they're doing their best in terms of what they can do in terms of this unprecedented crisis, right? It's something that is highly unpredictable, difficult to manage because it involves trying to manage the whole population, and it's not only a physical health problem any longer, right? It has had overreaching impact on the social structure, economy, all of that. So it's like playing a very fine balance. Whether they're doing enough for mental health, uh, the government is doing their bit, but I don't think that is enough at the moment, because currently their focus is obviously on the physical health impact of the illness, while the mental health impact of the illness is only going to hit us kind of in the aftermath of it. So I think that's when we'll have to really wake up, tighten things up, and start doing much more to help people who are really devastated by the after effects of the virus.
We have a question which came in from on Facebook, which says, I've completed 60 years in August 2019 and have been diagnosed with Parkinson's. Any suggestion on reducing the anxiety during this period of COVID and lockdown, uh, which enhances my hand tremors and may worsen the symptoms?
Mm.
So is there something that can be done for that? I'm trying to avoid watching too much of TV news and keeping busy in other activities, but still would like to know more on my options. That is Mr. Sanjay Sinha.
All right, Ms. Sinha, uh, like you said, the tremors of Parkinson's can worsen with anxiety. So uh, again, doing a lot of relaxation exercises. So breathing exercises would, even when you're not feeling anxious, would be very beneficial to help reduce this anxiety, because primarily anxiety triggers of a lot of uh, hormones in the body, which increases breathing rate, increases our heart rate. So, so deep breathing exercises or relaxation exercises would help us overall reduce the intensity of these body symptoms, and that could definitely help you reduce the tremors that are worsened by anxiety.
This is unfortunately the state of affairs. He says that there are people who are seniors who are account holders in one of the banks which had a run in, and all their savings were stuck in the bank. Each of them is suffering mentally, physically, no money in hand to survive, and nothing is being done about it, or so it appears. So clearly there are issues like these which people have.
Yeah, so that's what I'm saying. The whole uh, impact is uh, much wider than can be looked at only from the mental perspective alone. There are too many social, economic, financial, uh, political, lot of ramifications of this whole situation.
Uh, Great, doctor. Thank you for being with us. Any last closing remarks that you would like to give? Is there any uh, ready solution that you would offer people who have some of these issues, like the ones you've just heard? Obviously, senior citizens have anxieties. It's all right to say it's the new normal, but the fact of the matter is that it's a fairly abnormal state of affairs. So things that they should do just to chill.
Right. So in terms of uh, few things that we should try and do is, again, in spite of all the things that have kind of changed, try to go back to a reasonable schedule, go back to getting up and sleeping on time as before, have things to do throughout the day. So it may be gardening. If you say stop cooking, might as well start doing some of the cooking at home. Start doing little things that keep you engaged and alert. Get in touch with friends, family. Ensure that you're in touch with someone through at least in a day. You're speaking to one or two other people, especially for people who live alone. Always remember that there is support around you. If you find you are in a difficult situation, don't be afraid to reach out to anybody around you whom you think can help you.
Thank you, Doc. Thank you very much for all your time, and once again to all the people who have attended this session. Thank you for all your questions, and once again uh, taking advantage uh, of our medical talent that we have in this country, and we will keep bringing you top doctors every Saturday uh, at around 5 p.m. Thank you very much.
It's
Thank
been a
you.
pleasure. It's been a pleasure answering the questions, and I hope it was of help to many of them.
Thank you very much.